You have been walking every single morning. 30 minutes, same route, rain or shine. This is precisely what your doctor recommended, what every article about healthy aging tells you to do. And yet something is not adding up. The knees ache when you come home. The lower back tightens by midday. Your calves are heavy and stiff by evening. Some mornings your hips feel worse than before you left. And somewhere along the way you started to accept this as normal, as aging. It is not aging. What you are experiencing is what happens when the right exercise is performed the wrong way, consistently, every single morning. Walking done incorrectly does not just produce a smaller benefit. It actively loads your joints at angles they were not designed to sustain. It starves your cartilage of the fluid it needs to stay healthy. It compresses your spine with unnecessary force, and it drives chronic inflammation through tissue that cannot recover as quickly as it did at 40. 7 specific errors cause this. They are almost universal in people who walk regularly over the age of 60. And every single one of them is correctable, today, without equipment, without expense, and without starting over. Subscribe to Dr. Sam Sterling and leave a like before we continue. What you are about to hear, nobody is going to cover in a 15-minute appointment. Prevention does not generate revenue. That is why this channel exists. The medical system sees you after you stop walking, after the knee replacement, after the hip fracture, after the disc injury. Nobody gets paid to teach you how to walk correctly before any of that happens. Before the 7 mistakes, you need to understand what is happening in your body after 60 that makes every one of these errors more serious than it would have been at 40. 4 specific physiological changes alter your relationship with walking once you pass this threshold. The first is sarcopenia. This is the clinical name for the gradual, age-related loss of muscle tissue. After 60, the body loses roughly 1 to 2% of its total muscle mass every single year if no deliberate action is taken to prevent it. Over a decade, that is 15 to 20% of your total muscle. And muscle is not simply about strength. Muscle stabilizes your joints from the inside. Muscle regulates blood sugar. Muscle holds your spine upright and gives you balance when you walk. When muscle mass declines, joints become less supported, posture collapses, and balance deteriorates. Every one of the 7 mistakes becomes more damaging against this background. The second change is cartilage vulnerability. Cartilage, the smooth cushioning tissue between your bones, has no blood supply of its own. It receives nutrients exclusively through a hydraulic mechanism. When you move a joint under load, synovial fluid is pushed into the cartilage tissue, delivering the nutrients and oxygen it needs to maintain itself. When movement is wrong angle, wrong speed, wrong load, that fluid is pushed in incorrectly. Some areas of cartilage receive too little, and the tissue gradually thins. That thinning is osteoarthritis. And the most important thing to understand about osteoarthritis is that incorrect walking accelerates it, sometimes faster than no walking at all. The third change is vascular efficiency. After 60, your blood vessel walls gradually lose elasticity. Circulation to the extremities, your legs, your feet, the small vessels, becomes less efficient. This is why so many people over the age of 60 notice cold feet, heavy legs in the evenings, and longer recovery times after physical activity. Wrong walking habits make this worse by generating inflammation in the joints and soft tissue, which further impairs local circulation. The fourth change is the reduced margin for mechanical error. At 30, your body forgives a great deal. Slightly wrong posture, slightly too much speed, slightly insufficient recovery. The resilience of young tissue absorbs these errors. After 60, that forgiveness narrows dramatically. A mistake your body ignored at 35 produces real symptoms at 62. This is why the errors I am about to describe are not minor stylistic points about technique. They are the specific, documented causes of knee pain, hip pain, lower back stiffness, and chronic fatigue that millions of people are currently attributing to age. Mistake 1. You start your walk at full speed. Every single morning you step outside and immediately hit your normal pace. It feels efficient. Why slow down when you could just get going? But your body at rest is not your body in motion. When you have been sitting or lying still for hours, everything slows down to match. Your muscles are cool. Your joints are dry. Your cardiovascular system is ticking over quietly at rest speed. Starting a walk at full pace demands an immediate transition from all of that to full mechanical load. And that transition, performed too fast, causes measurable damage. Here is the specific physiology of what happens. First, cold muscle fibers are less elastic than warm ones. The protein chains that allow muscle to stretch and contract without injury require warmth to remain pliable. Cold fibers generate microscopic tears when loaded suddenly. Individually, each tear is invisible and painless, but walking incorrectly every morning means these micro tears accumulate. The result is chronic, low-grade muscle soreness that most people attribute to the walk itself, rather than to the manner of starting it. Second, your joints have not yet been lubricated. Synovial fluid, the viscous, shock-absorbing liquid inside every joint, pools in certain areas of the joint cavity while you are at rest. For it to coat the entire joint surface and form a protective film between the cartilage surfaces, it needs several minutes of slow, gradual movement. Start at full pace, and your cartilage is loaded before the lubrication is in place. That is cartilage running dry. Every morning. Repeated across years, this accelerates the exact breakdown you are trying to prevent. Third, your cardiovascular system has not had time to adapt. The heart does not respond well to sudden sharp demands. When you move from rest to full walking pace without transition, heart rate and blood pressure spike more steeply than they need to. After 60, when blood vessel walls are already less elastic, that unnecessary spike adds mechanical stress to vessels that cannot absorb it as easily as they once could. The fix is simple and costs nothing. The first 3 to 5 minutes of every walk must be slow, deliberately slow, almost uncomfortably slow. That is your joint lubrication phase. That is your muscle warmth phase. That is your cardiovascular preparation phase. After 5 minutes of slow walking, your joints are coated, your muscles are elastic, and your heart has settled into a working rhythm. Now increase pace. You have not added time to your walk. You have simply redistributed the first 5 minutes differently. Mistake 2. Your head is forward and your chest is closed. Go outside and watch people walk. The vast majority are hunched slightly forward, head leading the body, shoulders rolled inward, eyes aimed at the pavement a meter ahead. This posture is so universal it has become invisible. People assume it is simply how they walk. It is not how anyone should walk, and it is causing structural damage with every step. The physics are specific. An adult human head weighs between 4.5 and 5.5 kilograms. When it sits directly above the spine in neutral position, the neck and upper back muscles carry exactly that load. When the head shifts forward by just 3 to 4 centimeters, a shift most people do not even notice, the effective load on the cervical spine increases approximately threefold. At 5 centimeters of forward shift, it multiplies 4 to 5 times. This means instead of carrying 5 kilograms, your neck muscles are managing 20 to 25 kilograms continuously for the entire duration of your walk. That chronic overload produces exactly what so many people experience: neck tension, shoulder tightness, and headaches that appear after walking and are blamed on the exercise itself or on the weather. The second consequence lands on your breathing. When your chest is compressed and your shoulders are rolled forward, your diaphragm, the primary breathing muscle, a large dome-shaped structure beneath the lungs, cannot fully descend. Your lungs cannot fully expand. You breathe using only the upper portion of your chest, reducing the volume of air taken in with each breath. Less oxygen for working muscles, less oxygen for the brain. This is why some people return from a 30-minute walk feeling more exhausted than energized. Their lungs were operating at roughly 60 to 70% of their available capacity for the entire walk. The third consequence is the biomechanical cascade. Forward head posture forces the lower back into an exaggerated arch to compensate. The pelvis tilts. The knees operate at a slightly incorrect angle. The load distribution across the hip joint shifts. The result is increased stress on structures that were never designed to carry that stress. The inner compartment of the knee, the front of the hip, the lumbar vertebrae. The correction requires no equipment. Imagine a fine thread attached to the crown of your head, pulling gently upward. This does not mean straining or forcing yourself tall. It means allowing your spine to decompress along its natural curve. Shoulders relaxed, drawn slightly back, not a military position, simply anatomically neutral. Eyes on the horizon, chin parallel to the ground, chest open. In this position, your lungs work at full capacity, your neck carries its natural load, and your spine distributes walking forces the way it was designed to. Mistake 3. Your shoes are too old or wrong for your feet. Most people pay more attention to the walking route than to what sits between their foot and the ground. This is a serious mechanical error, and after 60, it carries consequences that simply did not exist at 40. Two age-related changes make footwear critically important. First, the fat pads on the soles of your feet thin out with age. These pads are your body's natural shock absorption system, dense, specialized tissue that cushions the impact of your heel striking the ground with every step. In your 30s, this natural cushioning is substantial. After 60, it may be reduced by 30 to 40%. That means ground impact that was previously absorbed in the foot now travels directly up the kinetic chain: ankle, knee, hip, lower back. Multiply that impact by 2,000 to 3,000 steps per 30-minute walk, and the cumulative load on unprepared joints becomes significant. Second, the muscles and ligaments supporting the arch of the foot weaken over time. The arch can begin to collapse, a condition called acquired flat foot or pes planus. When the arch collapses, the entire load angle on the knee changes. The knee joint is now operating in mild valgus, a slight inward collapse, with every step. This increases stress on the medial compartment of the knee, accelerates cartilage wear on the inner surface, and shifts the axis of the hip joint simultaneously. Good walking shoes must provide three things after 60. First, adequate cushioning in both the heel and the forefoot to replace the lost fat pad protection. Second, genuine arch support, not a rigid insole, but a sole whose inner shape follows the natural anatomy of the foot and prevents inward collapse. Third, flexibility in the front third of the sole. When you walk, the foot must bend at the metatarsal heads, the wide front portion. A rigid sole disrupts the natural heel-to-toe rolling motion and overloads both the calf and the Achilles tendon. One point that almost nobody mentions about shoes: the cushioning material in the midsole, the layer between the outer rubber and the inner lining, degrades with use long before the shoe looks worn. If you walk regularly, the cushioning in your shoes has likely lost between 40 and 60% of its shock-absorbing properties after 1 year of regular use, even if the outer sole still appears intact. Replace walking shoes approximately once a year. This is not a commercial recommendation. This is osteoarthritis prevention at one of its simplest and most direct points. Mistake 4. You walk once a week for a long distance. The pattern is almost universal. Monday to Friday, no walking. Saturday morning, one long walk, 45 minutes, sometimes an hour. Come home tired, feel the virtue of it, consider the week complete from a fitness standpoint. This approach feels reasonable. From a physiological standpoint, it is fundamentally wrong. Your body does not respond to isolated bursts of activity. It responds to repeated signals. Every time you walk, your body receives a physiological message. Physical activity is the norm for this organism. In response to that message, repeated consistently, the heart gradually strengthens. Blood vessels adapt, muscles develop, metabolism stays active between sessions. This is called training adaptation. It is the mechanism through which exercise produces health benefits. And it only occurs when the signal is repeated frequently enough for the body to treat it as a permanent new condition rather than an occasional event. One walk a week is not a frequent enough signal. The body never adapts because the signal never persists long enough to require adaptation. The cardiovascular benefit stays minimal. The metabolic benefit barely registers. There is a second, more immediate problem. A single long walk after 5 days of relative inactivity is a stress event for tissue that has spent those 5 days returning to its resting state. Muscles that were not active on Tuesday, Wednesday, Thursday, and Friday are now being loaded for 60 minutes on Saturday. Cold, unadapted, unprepared. The delayed onset muscle soreness that follows, the heaviness and aching on Sunday and Monday, leads people to the wrong conclusion. They conclude that walking hurts them, that their joints are not built for it. In the vast majority of cases, their joints are fine. The loading pattern is wrong. Evidence is clear on the minimum effective dose. 20 to 30 minutes of walking on most days of the week produces measurable reductions in cardiovascular risk, blood sugar instability, and inflammatory markers in the body. That is 5 to 6 sessions per week, not one. If 5 days feels too much right now, begin with 3. Keep each session to 20 minutes. After 2 weeks, add 1 more day. After another 2 weeks, add 5 minutes to each session. The principle is gradual, consistent progression. Your body adapts to what repeats. Only to what repeats. If you are still with me, drop your age in the comments. And tell me which of these 4 mistakes you recognized in your own daily walk. I read every comment personally. Mistake 5. Your arms are not moving. Most people either hold their arms stiff at their sides, let them hang, or put their hands in their pockets. This feels natural. In reality, it eliminates a significant portion of the physiological benefit of walking and creates a mechanical problem in the spine with every step. Walking is not a lower body exercise. It is a whole body cross-pattern movement. Your nervous system hardwires the left leg and right arm to move forward simultaneously, and the right leg and left arm to follow. This cross-coordination pattern distributes the rotational forces of walking symmetrically across the spine. When you step forward with your left leg, the right arm swings forward and counterbalances the torsional force. The spine stays mechanically neutral. When the arms do not move, the spine must absorb all of that torsional force without the counterbalance. For people who already have lower back vulnerability, which describes a large proportion of people over the age of 60, this spinal loading pattern contributes directly to the lower back pain that appears after walking and is blamed on age or disc problems. Second, arm swing recruits the muscles of the shoulders, the upper back, and the chest. When the arms swing correctly, a substantially larger proportion of total muscle mass is active during the walk. More active muscle means higher caloric expenditure, better systemic circulation, and a stronger metabolic signal from a shorter walk. The same 30 minutes with proper arm movement delivers a meaningfully stronger physiological effect than 30 minutes with static arms. Third, and this is the point most people do not know, arm movement actively maintains coordination. Smooth, rhythmic, alternating arm swing requires and reinforces the neural coordination pathways that also govern balance and gait stability. After 60, these pathways begin to degrade gradually if they are not used. Every walk with correct arm movement is a form of neural maintenance, keeping the coordination circuits active through use. The correction is simple. Bend your elbows to roughly 90 degrees. Allow them to swing forward and back in natural rhythm, opposite to your leg. You do not need the aggressive pumping motion of a competitive walker. You simply need to stop pinning your arms to your body. Within 2 or 3 walks, this becomes automatic, and the walk immediately feels more effortless and rhythmic. Mistake 6. You are not breathing correctly while you walk. This is the mistake that nobody else is talking about, and it is one of the most consequential. Most people breathe during a walk exactly as they breathe at rest, chest breathing, shallow. Upper chest rising and falling with each breath, diaphragm barely engaged. This pattern is sufficient when you are sitting quietly. During walking, it is inadequate and produces a chain of consequences that explain exactly why so many people feel exhausted, slightly anxious, or oddly tense during and after their walk. Here is the mechanism. The diaphragm is the primary breathing muscle. It is a large, dome-shaped muscle that sits below the lungs and separates the chest from the abdomen. When you breathe correctly, the diaphragm descends on inhalation, creating negative pressure that draws air deep into the lower lobes of the lungs, the largest and most richly vascularized portion of the lungs, where the most efficient oxygen exchange occurs. When you breathe with only the upper chest, the diaphragm barely moves. Air reaches only the upper lungs. You are using approximately 30 to 40% of your available lung capacity with every breath. The consequence is measurable and immediate. Less oxygen per breath means the body must breathe faster to compensate. Faster breathing activates the sympathetic nervous system, the fight or flight response. Cortisol and adrenaline begin to rise subtly. The body reads the fast, shallow breathing as a stress signal and responds with a mild stress response. This is why some people feel slightly anxious during a walk without any obvious reason. Their breathing pattern is generating a low-level stress signal that has nothing to do with their thoughts or environment. There is a second consequence specifically relevant after 60. The vagus nerve, the long nerve that runs from the brainstem through the chest and abdomen, regulating heart rate, digestion, and inflammation, is activated by deep diaphragmatic breathing. Slow, deep exhalations specifically stimulate the vagal pathways that reduce inflammation and calm the cardiovascular system. Every 30-minute walk with correct breathing is simultaneously an anti-inflammatory session. With shallow chest breathing, that benefit disappears entirely. The correction is straightforward. Breathe in through the nose for a count of 4, directing the breath downward so the belly expands, not the chest. Exhale through the mouth for a count of 6. The longer exhale is deliberate. It is the exhale phase that activates vagal tone and produces the calming, anti-inflammatory effect. You do not need to maintain this count for the entire walk. 3 to 5 cycles at the start of each walk is sufficient to establish the breathing pattern and allow the diaphragm to take over naturally. Mistake 7. You stop the moment you get home. The walk ends. You come through the door, sit down, and consider the work done. This is the most common and most overlooked mistake of all. Because the 20 minutes immediately after you stop walking are when the most important physiological repair work happens, and most people spend those 20 minutes undoing it. First, water. Muscle tissue is between 70 and 75% water. Every biochemical process that happens in muscle after exercise, the repair of micro tears, the removal of metabolic waste products, the restoration of glycogen, the reduction of local inflammation, happens in an aqueous environment. Even mild dehydration, a 1 to 2% reduction in body fluid, measurably slows all of these processes. After a 30-minute walk, you have lost fluid through sweat, through exhaled breath, through the dead. Simple metabolic demands of working tissue. A glass of water within 10 minutes of finishing your walk is not optional. It is a metabolic necessity that most people ignore. Second, stretching. During walking, your muscles work in a repetitive shortening mode. They contract hundreds of times in a relatively fixed range of motion. Without deliberate lengthening afterward, they remain slightly shortened when you stop. Over weeks and months, this accumulates. The calves tighten. The hip flexors shorten. The hamstrings lose extensibility. The result is the progressive stiffness that develops in people who walk regularly but never stretch. A stiffness they attribute to age, when in reality, it is an entirely preventable mechanical consequence of incomplete recovery. 5 minutes of targeted stretching after every walk addresses this completely. The 3 areas to prioritize: the calf and Achilles, stand facing a wall, 1 foot behind the other, press the back heel into the wall, floor, and lean forward gently. The hip flexor, 1 knee on the floor, the other foot forward, shift your weight forward until you feel a stretch at the front of the rear hip. The hamstring, sit on the edge of a firm chair, extend one leg with the heel on the floor, lean gently forward from the hips. Each position held for 30 seconds. Both sides. That is 4 to 5 minutes total. It is the difference between a walk that produces stiffness and a walk that produces recovery. Third, rest days. If you walk every day without exception, the tissue never has time to complete the repair cycle. Your body does not adapt during exercise. It adapts during recovery. Muscle fibers reinforce themselves during rest. Joints remodel in response to load during the hours after exercise, not during the exercise itself. 1 to 2 rest days per week is not weakness. It is the physiologically correct protocol for sustainable adaptation. People who walk 7 days a week without rest often plateau or decline in performance because the repair cycle is perpetually incomplete. The walk is only half the equation. Movement, water, stretching, rest. As a complete system, walking produces durable, long-term health benefits. As isolated movement without recovery, it produces the aching, stiffness, and fatigue that so many people over the age of 60 are currently experiencing and accepting as inevitable. It is not inevitable. It is a protocol problem. And now you have the correct protocol. Here is your action plan. Not next week, starting with your next walk. Step 1. Set a timer for 3 minutes when you step outside tomorrow morning. For those 3 minutes, walk at a pace that feels almost embarrassingly slow. Slower than you think is necessary. Your joints are lubricating. Your muscles are warming. Your heart is preparing. After 3 minutes, increase to your normal pace. This single change will reduce the knee and hip aching you experience on returning home. Most people notice the difference within 3 to 4 walks. Step 2. Before you walk out the door, stand in front of a mirror for 30 seconds. Pull your head gently upward as if a thread is lifting the crown. Relax your shoulders down and slightly back. Open your chest. Memorize that feeling. That is the position you will maintain throughout the walk. Check it again at the halfway point by touching your chin with your finger. If your chin is tilted down, correct it. Step 3. Pick up your walking shoes right now and look at the inner sole and the outer heel. If the heel is worn unevenly, if the sole no longer springs back when you press it firmly with your thumb, if you have been walking in these shoes for more than 12 months, replace them. This is the single highest return investment you can make in your joint health. One pair of good walking shoes costs far less than one physiotherapy appointment. Step 4. Commit to 4 walks this week instead of 1 or 2. 20 minutes each. It does not need to be 30. It does not need to be fast. 4 sessions of 20 minutes produces a stronger adaptation signal than 1 session of 80 minutes. Write the 4 days in your diary before you close this video. That commitment, made now, is worth more than any piece of equipment. Step 5. On your next walk, after the 3-minute warm-up, take 5 slow breaths through your nose, directing the air downward into your belly. Count 4 in, 6 out. Feel your abdomen expand rather than your chest rise. This establishes diaphragmatic breathing and activates the vagal anti-inflammatory response before you reach your normal pace. You will notice that the walk feels easier and that you return home calmer than usual. That is vagal tone doing exactly what it was designed to do. Step 6. Place a glass of water on the counter before you leave. It should be waiting for you when you return. Drink it within 10 minutes of finishing your walk, before you sit down, before you check your phone, before anything else. Then spend 5 minutes on the 3 stretches described for the calf, the hip flexor, and the hamstring. Set a timer if you need to. 5 minutes. Every walk. Without exception. Step 7. Check your current weekly walking schedule and remove 1 day entirely. If you are walking every day, make 1 day a rest day. If you are walking 3 days, reduce to 2 until your recovery soreness clears. Then build back up gradually. The walks that are missing from your week are not failures. They are the sessions during which your body is doing the repair work that makes next week's walks stronger. If this video gave you something your doctor never had time to say, subscribe to Dr. Sam Sterling, leave a like, and tell me in the comments, which of the 7 mistakes was the one you recognized most in your own daily walk? I read every comment, and I will see you in the next one.